Hello, teacher. This is the first exercise of the Unit 1. For point 1, match the symptoms to the questions using your medical knowledge. Dysuria is B. Do you have any pain when you pass water? Dysphagia is D. Do you have any trouble swallowing? Diplopia is E. Is your vision normal? Dysphasia is C. Do you have any difficulty with your spine? Dysphonia is A. What is your breathing like? Okay. 4.2. Patients are describing symptoms of the conditions shown in brackets. Complete the sentence. Number 1. I have got pain and numbness in both feet. 2. I'm having difficulty swallowing solid food. 3. I have a lot of problems passing urine. 4. I've been sweating more than usual even when it's not hot. 5. I've noticed that my hands shake when I am not using them. 6. I have trouble breathing when I climb the stairs. 4.3. Complete a sentence. 1. When I eat solid food, I have to chew it for a long time before I can swallow it. 2. Do you have any pain when you pass stalls? 3. I have no appetite and I've lost 5 kilos in the last few weeks. 4. When did you last have a period? 5. The garden is full of flowers, but my sense of smell has disappeared and I can enjoy the perfume. 6. Take a deep breath in. 6. Take a deep breath in. Over to you. You think a patient may have diabetes? Think of 5 questions you can ask the patient to investigate further. Try to use the question types present in this unit. Have you feel tired? Have noticed that your thirst and to urinate have increased? How is your sense of vision? Do you have any numbness in your hands and feet? Do you feel any difference in your weight?